Okay, great. So we have Alexis here with us today. Alexis, can you please state your full name and the organization that you work for?
Yes, my name is Alexis Whitmore, and I work with the centers.
Okay, great. Alexis, thank you so much for being here today on this podcast and at CHW Day. And we just want to ask you a couple of questions.
Absolutely.
So basically, one of the things that we really like to ask community health workers, we find that there's usually a big why behind the work that they do. So would you like to share what your why is?
Oh, yes. So my why is I absolutely love helping people. I believe in almost all of the positions I've ever been in, that has been the biggest aspect of the job, at least in my heart. So helping people and being there for people has been what drives me in whatever career path I'm in. I started out, many years ago as a medical assistant and realized after meeting a community health worker, that's what I'm doing, working with my clients, but also reaching out to them and saying, oh, I need help with prescriptions. I can't afford them. And so when I really dug deeper into what a community health worker was, I saw a lot of the attributes that I already had. And so then it was just like, wow, well, this is a no-brainer. Like, this is what I'm supposed to be doing. And so then gaining more knowledge into that field and learning more, and then actually getting into it and working it and being there for people, and getting deeper into it, because it's more than just helping someone. It's really sometimes when you don't have the help, when there is no help and you're just there to sit comfortably with and allow them to share in that space and comfort them in knowing that, like with housing, like there's nothing I can do with housing right now, but we can sit and talk about, how crazy it is that we can't do anything right now, but we can still make a plan, and I can be there emotionally and support them in that space. So that's my why.
That's very powerful. And it's really great you were able to connect the dots early on to decide like, hey, all the things that I'm really passionate about are actually everything a community health worker does.
Yes.
So has that why changed at all for you since you started and up until the current present now?
Yes. My thought of what this position was or what this entailed was very just like a spread, just gently spread. And as I said, going deeper into it and doing this, it's been 4 years now, a little over 4 years. And just seeing where I've come from, where I started and where I am now. Yes, it's changed a great deal because I love it even more. It can be tiring. It can be exhausting. But then also you get those peaks of the rainbow in between where you're like, yes, this is why. I can remember just recently leaving a client and walking back to my car and just smiling to myself like, God, I love my job. I love my job. So yeah, it has changed a great deal. It's just more rewarding every day.
And that's actually a perfect segue into my next question. Do you have a very meaningful experience that you'd like to share from your perspective in
Yes. So
work?
I talk to strangers, and which is another reason I think that I'm such a great community health worker, because I just talk to random people. I was out with a client actually doing a legal clinic, and while we're there, I see this baby. And so that's my weakness. Babies are my weakness. So, the baby's vibing with me and I'm vibing with the baby. And so I decide, I guess I'll talk to the mom too, right? Don't want to make it too awkward. So I begin, conversing with the mom, and we're talking, and she said, a little bit of this, a little bit of that. And, I got my handy dandy book bag with me with all my resources and information. So I'm pulling stuff out, just kind of handing it to her. And then she says, yeah, and I'm pregnant, and nobody really can tell because I'm so little. And so then I kind of hit her with, I'm a doula also. Yeah, surprise.
Oh, cool.
So, while I'm there, and I'm with one client and we're doing this legal clinic and we're handling business. And then just to turn around and kind of meet somebody, and in my head, I already was like, oh, here's my card. You're my client now. Like, you're mine. You're mine. We're going to get through whatever this is and the obstacles and the hills and valleys. But, Yep, you just made a friend. So yeah, that's my story.
It sounds like the stars aligned on that one.
Yes, it was. And continues. Yes.
That's wonderful. Well, thank you so much for sharing your stories from your perspective. And thank you for being on the podcast today. And
thank you.
I hope you enjoy the rest of CHW Day today and really enjoy all the activities.
Thank you.